Hi, my name is Arlie Dudar. I am a birth doula practicum student from College of the Rockies in Cranbrook, BC. This is video number 3 of my 6-part video series on birth doulas and how they can help you have a better birth. Video number 1, we talked about what is a birth doula and how a birth doula fits into your birthing team. Video number 2, we talked about non-pharmacological or drug-free pain management strategies. And today, in video number 3, we are going to talk about birth plans. What they are, why they're a good idea, who to give them to, and a couple of other features that I just want to add to really maximize your use of them. Okay? So, first, what is a birth plan? A birth plan is, well, some people have described it as the map of your baby's birth, which is a nice way of looking at it. I like to think of it as it's the route that you're going to take, or route, I guess. It really depends where you're watching from. Route of your labor and your birthing of your baby. So you know where you're going, right? Your destination is cut out for you, but you can choose how you get there. You can take the long and scenic route. You can take the straight shot all the way there. You can hit up a few nice spots along the way. It's up to you. Now, that being said, your birth plan is your plan A. That is, if everything is going beautifully, it's going perfectly. And if there is a problem, you need a contingency plan. You need a plan B or a plan C to say, okay, I know I need intervention. This is what I don't want. Or if I have intervention, I would like to do X, Y, Z. We can cover that as well. And I'll cover that in just sort of my end notes on this video. Okay, so there are a lot of templates online for birth plans. As I mentioned before in my last video, I'm technologically inept, so I'm not going to show you a fancy birth plan on this video. You can just look it up and just search it on a search engine and you'll find lots of really cool templates. They're customizable, a lot of them. You can also just use them to get your own inspiration. So they will include between 5 and 10 different sections. And these are some of the main points that are going to be hit on, okay? So first, your birth plan should always include your basic demographic information, your name, your phone number, your age, whether or not this is your first birth, your expected due date, and your location, your preferred location to give birth. And this, again, goes along with that contingency plan, right? This is your perfect world. This is your birth plan. And in case of emergency, you need to know what is nearby. So if you want to give birth at home, how close are you to the nearest hospital? And if you need to go to that hospital, what are the policies and procedures there? What is the floor like? Just in case, right? It doesn't necessarily mean that you are calling that possibility of going to the hospital into being. You're not making it happen by preparing for it. It's just a realistic perspective. So when you have a spot for your, preferred location for giving birth, keep that in mind, that you want backups. And along with that, you want backups in terms of who's going to get you there. Okay, and so that's the first part. And along with that basic demographic information is probably going to be your partner's information as well. And then there might be another section for your preferred company, who you want to be in the room with you. Some people want their mom or their sister or their best friend. Some people want a doula and a midwife. Some people want just their partner. It's really up to you, and give it a lot of thought, because while you and your partner may be a great team, it's okay to discuss with them, we're not the greatest under pressure, and I think we need somebody else there to help keep us calm, like a doula or a midwife or whoever may play that role for you in your birthing experience. Okay, so preferred company is there, and you may want to include their phone numbers if there's space or you feel like it's necessary. Um, and then I think it's also good to include your environment preferences. Now, if you're giving birth at home, you have full control over your environment preferences. You can, you know, get up and get a drink when you want to. You can move around to different rooms. You can, have very specialized lighting, different lamps that you like if you want, right? In a hospital or a birthing center, it's a little bit different because those options are somewhat limited. And here is where you may say, I want to bring in certain things. So that may include, bringing in your own clothing to feel a little bit less institutionalized in a hospital. So you're bringing in, let's say, like your own bathing suit if there is a tub there. You're bringing in your own nightgown, that you feel comfortable in, or you're bringing in, like a nursing bra so that you can nurse immediately afterwards. Um, and then there's also things like lighting. So, saying I really want dim lighting, or I'm going to bring in this side lamp that, provides a really nice atmosphere, and I don't want any other light unless it's absolutely necessary. Or you may say, I really want the door to be closed. You may say, I strongly only prefer females in the room, unless it's absolutely necessary to have a male. Like if the anesthetist is male, or if your obstetrician is male, or the obstetrician on call is male, things like that are kind of extenuating circumstances. But again, we're thinking your perfect world, this is your game plan. So those are all environmental preferences. And then you can add anything else as well. So, saying, I want a special blanket from home. I want to bring in my receiving blanket for my baby. I want to bring in, our nice quilt or our nice duvet or whatever to be covered up in afterwards. Anything like that is appropriate to bring in. And it's a good idea to check with your facility to see if they will let you bring in all that stuff, because most of it is okay, but then there are some policies under different health authorities that may prevent certain items. Okay, so that is for environmental preferences. And then there is guaranteed going to be a section, and you are going to want to fill this out and think about this carefully, for pain management options. So you're thinking about your drug-free and your drug analgesic options here, and just saying, I like this, but I don't want this. So I like massage, but I hate it when people stroke my hair. And that may change again in the moment, right? But you can say, if you have a particular association to something, you can say, I absolutely do not want people to do acupressure on me. Like for myself, acupressure doesn't really work. Again, it may work in the moment, and there is a possibility of changing my mind, but that's not one of the first things I want people to try. Because when you're in the stages of labor, you're in a very vulnerable position, and sometimes you'd be willing to try anything, but you want people to have a general idea of what you think is okay, right? And try all those things first. So there can be a section for that. And you can also include, if you'd like, some personal preferences for, let's say, aromatherapy. So I really want to bring in certain essential oils like lemon and basil and, mint may be a good one, or jasmine or rose, things like that. So those are non-pharmacological. In terms of the pharmacological options, the medicated pain management, you can indicate whether or not you're okay with an epidural. And on the note of epidurals, again, it's okay to change your mind. And here I want to talk about a safe word. I was going to talk about it later, but I think I'm going to talk about it now. Uh, Lamaze International recommends having a safe word for an epidural and other medical procedures that say you don't want, or you want only if you use your safe word. And it could be something completely random that you're not going to say, but everybody knows what your safe word is, and that is the indication that you absolutely know that you need that thing. So with epidurals and with safe words, it's important to have them because in the moment when you are having these contractions that are lasting, you know, for a minute, they're strong and they are all consuming, and you lose track of time, you lose track of the environment, and you may think, oh my God, I can't do this. I'm overwhelmed. This is taking way longer than I thought it was going to take. I am exhausted. I'm done. I just want that epidural, right? And you can say that, but those are all things that are said in the height of pain and stress, which we all know we say things when we are highly stressed that we don't always mean. So, hence the importance of a safe word. Okay. It seems kind of like a silly idea, but just consider it, and consider if it's something that may work for you. Another medicated option that you may want to choose is laughing gas. So some people may be okay with this, some people may not. Indicate on your form if you're okay with it, and again, think about your safe word. Okay. Um, and another related section to medicated pain management is interventions. So there are a lot of interventions that are mentioned. I'm actually going to do another video on interventions just to talk about various common ones and sort of the risks and benefits involved. Um, but right here, I will just mention them really quickly. So, you know, a lot of hospitals, it's standard procedure to insert an IV. And that does not mean that you're going to be hooked up to fluids. It just means that they're going to put in what's called a saline lock. I mean, here in BC, it's called a saline lock. I don't know what you call it in other places, but it's basically just the IV and a short little piece of tubing that is inserted in a vein, and it just sits there, and it is there in case of emergency. So I'm talking, you are severely hypotensive, like your blood pressure has hit the floor and you need fluids now. Or you're hemorrhaging and you need blood products now. So that's another thing that you may want to consider for interventions, a type and cross match for your blood type, just to make sure that it is on file with the hospital. Um, as a side note, a fun fact, a lot of you probably already know that the universal donor for blood work is O negative. So if you are O negative, then you need O negative blood. But if you have any other blood type, you can receive O negative and you'll be okay. All right. So anyway, that's just a side note about blood types and type and cross matching. So that's one intervention, is having an IV. Or another, might be, right, we talked about epidurals. We haven't really talked about C-sections. So C-section is in case of like extreme emergency, and you can delay it as long as physically safely possible, but then there may come a point where your medical team, your birthing team says, this is the time to do it. So think about, you know, if you're okay with it and what circumstances you're okay with it, and that can go in your birth plan as well. And again, we can talk about C-sections in another video on interventions. Another intervention may be fetal heart rate monitoring. So you can do external or internal. External involves electrodes and a sensor that is put on the outside of your belly, right? It does limit your movement because it involves a band that goes all the way around your the circumference of your abdomen, the top and the bottom. It measures your heart rate and the baby's heart rate. So external heart rate monitoring is not a bad thing, but it can provide some, false feedback. Anyway, I'm not going to get into it, but that's one thing. Internal fetal heart rate monitoring involves electrodes actually attached to a baby's scalp. Typically, this is reserved for women who are higher risk, or the baby may be higher risk, and it is a higher risk procedure. And other interventions may include, keeping you NPO or nothing by mouth, just in case they need to do surgery or they, need to do something else. There are a lot of different interventions that you can have. So this is one place on your birth plan that if you find these templates, they can list a lot of them. The ones that I've just mentioned, as well as a number of others. So with those interventions, I may have mentioned this before, but you really want to be careful about what circumstances you're okay with having those in. Okay. Circling back to IVs and blood products. If you are somebody or you belong to a cultural group or a religious group that does not accept blood products, make sure you write that in your birth plan, because that is something that the medical team and the birthing team will absolutely want to know. Okay. Another section that is involved in birth plans is post-birth. So what happens after your baby's born? And this can include things like cord clamping. Do you want delayed cord clamping, or do you want it done right away? Do you want the cord to not be clamped at all at the hospital? And some people, what they do is they'll take their baby home with the placenta attached, and then the placenta will gradually dry up. The cord, the umbilical cord, will dry up, and then you can just kind of cut it and tie it off. So that's something to think about. Another thing is if you do want to cut the cord at the birthing center or hospital, or if you're at home and you want to cut it, who wants to cut it? Is it you as the mom, or is it your partner? Is it your midwife or doula? Is it your support person who's there who is, maybe like your best friend? So think about those things. You may also want to think about your baby. Do you want your baby to be wiped down when it comes out? Babies, when they come out, are covered in amniotic fluid and something called vernix. It's kind of like a white, I hate using this word, but cheesy texture. It's like, it's thick and you can kind of rub it between your fingers. And the closer to term and post-term your baby is, the more vernix they may have on them. Okay, so do you want your baby to be wiped down and clean when it's handed to you, or do you want him to just be handed to you just freshly? Another thing is, do you want to, delay what's called APGAR scoring? The APGAR is an acronym that is used widely in North America for scoring infants, scoring neonatals, and it basically measures the reflux, the respirations, the heart rate, and a couple of other things for your baby. So A lot of the APGAR scoring can actually be done like hands off just by observation. And so you may want to, say that as your preference. I want it to be delayed, or, if baby is healthy, can we just wait for weighing, which is another thing. Or, they might do a heel prick for, like blood sugar if they're concerned about that. Can we wait for that or not? And this is another thing to talk about with your obstetrician or your midwife is, what can I wait with and what do I need to do right away? So it's important to actually run your birth plan by them, these people that are involved in your birthing team. Okay, so those are some birth procedures, post-birth procedures that you may want to think about. And if you find any more, you hear of any others as you're talking to people, or you're talking to your midwife, or your obstetrician, you can add them in and say, yeah, this is what I want with that circumstance. And then another thing that I want to mention is breastfeeding. So there are a lot of people who have had babies who have had a somewhat, I'm going to use the word traumatic experience with their breastfeeding, their brand new baby, and maybe they weren't able to breastfeed right away, and it really got to them. Or some people may not have been offered the chance to breastfeed, or some people, their baby may have had really, really low blood sugar, and so the medical or birthing team says, we need to give your baby formula, which is bottle feeding, right? Which kind of can delay your breastfeeding, actually. So, the other thing is that this colostrum comes into your breasts before your actual breast milk comes in. So colostrum is like pre-breast milk, and it has a lot of really good nutrients in it. And if you're not able to breastfeed, you can try hand expressing it, manually expressing it, so that you can actually, maybe you do bottle feed the baby, but you're bottle feeding him or her colostrum. So you're still essentially sharing all of your nutrients and all of your immunity boosters that are naturally in your breast milk with your baby. So those are a couple things to think about with breastfeeding. And there are some really beautiful, touching stories about breastfeeding immediately after birth. I encourage you to check them out. Again, you can just look them up on your search engine. There are some really, really beautiful moments. And there are some really alarming stories. So they're good for education. And I'm going to say this, I said it before to a potential client, and I'm going to say it to you now. When you are looking at these stories of other people who've had babies and they are, talking about their breastfeeding experience or talking about their labor and birth experience, take the information that they give you and leave their bias and their emotional input behind. Leave it aside and just take the facts with you, because it's your experience. Everybody is so different, and that goes along with your birth plan too. Everyone is going to be so different, and there's no right or wrong at all. And, as I said initially, you may change your mind and you may need to have a backup plan or two. And if you, need a C-section, who do you want to be in there with you? If you need an epidural, you can ask them to wait until, you're dilated to however many centimeters. You can ask them to, do a cervical check before you get your epidural, so that, that might be the encouragement that you need. So in the moment, you may say, oh my God, I need this epidural, but wait, we wanted to do a cervical check first. And that is where your doula can also come in handy to remind you and keep you on track with your birth plan. Because in the moment, you are desperate to do anything to, relieve yourself of that discomfort, to get your baby out safely, to, to have that painful moment be over. So that's something to think about. And the last thing I want to say about birth plans is that even if, like, after the birth of your baby, and it's been a couple of hours and you're snuggling with baby and your loved one there, or your support person or whoever, your midwife goes and your doula goes, and the nurses will change shifts, and your obstetrician is not going to be in there a lot. So you are advocating for you at that point. And I know that this is kind of like a scary possibility. Most doulas stay a couple hours afterwards, but then they go home, right? And if you need to go to ICU, or you need to stay overnight, or your baby needs to stay for monitoring, it's important to have a general feel with your birth plan, a general culture in it. It's the best word I can use to describe it. But you want the birthing team and whoever's left of the birthing team, once your doula or your midwife has gone home, as I said, to know what you'd want. You want them to know, look, I want to keep trying breastfeeding, or, I really want to room in with my baby, and I really want to do a skin to skin as much as possible, as much as I physically can. So, that is really important to me. It's really important to bond with my baby. And so those are some guiding lights that can give uh, the medical team, if you're at the hospital, some direction in terms of what to do. They know generally what you would want, and it can help improve your birthing experience and your maternity experience after that. Okay, so that is it. That's all I have to say. I'm not going to take up any more of your time. In this video, we talked about birth plans, what they are, generally speaking, what they include, why they're important, and who to give them to. Okay? And in the next video, we are going to talk about... we're going to talk about some alternative labor and delivery practices that people may want to employ. And specifically, I'm talking about use of the rebozo. We're going to talk about hypnobirthing, and we're going to talk about prenatal yoga. So that will be next time.